1 second while we wait for everyone else to join, and I think that's everybody there. Perfect. So once again, thank you very much for joining our World Horse Welfare webinar tonight on how to prevent colic. And as always, we are very pleased to see so many of you attend these live webinars. You can continue to support World Horse Welfare and ultimately horse welfare in many ways. And one super easy way is by encouraging friends and family to attend or watch these webinars too. So as you will know, that anyone can register for free, which we feel is the best way to participate. But you can also watch these live on YouTube and subscribe to our YouTube channel. And that means you can watch it back later at any time that's convenient. The link should now be available in the chat. That will let you do that. So I'm just going to quickly share my screen. And hopefully that is now sharing. So I'm really pleased tonight to be able to be joined by Vet Kate Blakeman to explore how we can prevent colic in horses. We really want people to be involved in this webinar, and so please remember that this really is a two-way conversation. There is, for those joining us on Zoom, a Q&A tab, so please ask any questions you have there, and there's also the chat function, so you can share any views on the chat function too. For those of you on Zoom, you can use that feature. And please, if you do enjoy today's discussion, please encourage others to attend and share it with your friends. We do welcome ideas on topics. So again, you can either let us know in the chat, or if you email education@worldhorsewelfare.org, you can drop us a line and let us know of any topics you might want us to cover in the up and coming series. So again, anyone who attends previously will know that we like to start with a bit of a poll question. So today's poll question is, have you ever owned or managed a horse that has experienced colic? And you've got a yes, no, or an I'm not sure answer there. As you're answering that question, I'm just going to quickly introduce Kate. Let me just do that. So so Kate, as I said, is a vet and has been in practice for the last 17 years, and a mixture of ambulatory and in hospitals. She is a clinical assistant professor in equine practice at the University of Nottingham, teaching final years in equine practice, and also is the Beaver Junior Vice President. For an interesting fact about Kate, Kate very kindly agreed to step in to talk to us tonight very last minute, as the original presenter came down unwell. So yeah, Kate should have we're very much championing Kate, and yeah, thanking her massively for her last minute agreement to come and do this. So thank you very much for that, Kate. I am going to stop sharing my screen, and I'm going to pass over to you, Kate. I will let you know when I can see it. Your screen. So if you want to share your screen, Kate.
Okay, thanks, Alana. So welcome everybody. Thanks for having me tonight. Yeah, as Alana said, I'm a last minute replacement for John tonight, but I'm looking forward to talking to you all this evening. Obviously, the topic of the talk tonight is colic. Why do horses get it, and more importantly, how can we prevent it? So hopefully after tonight's webinar, then you'll all feel a little bit more informed. So why is colic so important? Unfortunately, it is responsible for a large number of our vet visits, and mostly emergency visits out to horses. And this can be a really important and concerning situation for owners to find themselves dealing with. And sadly, it is the major cause of death or euthanasia in the horse. So it's something we need to know about. It's something that we need to know how to deal with, and more importantly, how we might be able to prevent it. So tonight's webinar is going to sort of be broadly broken down into sort of 3 different sections. A bit of an overview of the anatomy of the horse's intestines, because they are different. They're different to many other species. They've got some weird and wonderful intricacies. So we're going to go through how it's supposed to work. We're going to talk about when it goes wrong, so what types of colic we can be faced with. And also think about the risk factors and the prevention of colic. What can we do as owners and carers of our horses to prevent colic occurring? So my background, Alana did introduce me. I'm an equine vet. I graduated in 2007. I've worked both in the UK and in Australia. in a mixture of private practice and referral hospitals. But now my role is mainly for teaching final years at Nottingham Vet School, so before they go out into clinical practice. So we're going to start off thinking about the anatomy and function of the horse's GI tract. Because I think if we can understand this and then we've got an appreciation of this, then we can understand how best to optimize it. So this is a very basic schematic. I'm sorry, this is very basic, but I think it does cover a lot of the points that we need to consider. So obviously the food starts going in from the front end. So we're thinking about our lips are in incisors. This is how horses will pick up, prehend food, bite off food. They then obviously chew it with their molars, and their cheek teeth grind the food. Then follows, they swallow, and it follows along with saliva. This is only produced in the horse when it's chewing. Okay, so unlike us, we release saliva in response to a feed. Horses release it when they're chewing. So maximizing the amount of time that horses are chewing are really important for a number of conditions. The main function of this is to moisten the food, but it also helps neutralize stomach acid. It then passes down the esophagus, which is basically a tube down the neck, which will transport the food from the mouth to the stomach. Okay. The stomach is actually really quite small in the horse in relation to the size of the animal. And this is where non-fibrous food is started to be digested. The stomach empties very rapidly, probably every 30 minutes. And horses, I'm sure many of you are aware, are not able to vomit. Now, this is where things get slightly interesting, or a lot more interesting, I think, from the horse's point of view. So they've got many, many meters of small intestine, and these are really, really mobile. So they're mostly suspended from a central point within the abdomen, and digestion of non-fibrous food, so their starches and sugars, will start here, and absorption will occur here. But food moves rapidly through this part of the intestinal tract, and excessive starch and sugar from their diet isn't digested. If you think about the next part of their intestinal tract is the cecum. So this is a massive blind-ended fermentation vat. Okay, so this is full of bacteria and protozoa, and their job is to ferment or break down fibrous feed. And this is how horses get their energy. So we really want to maximize the fiber intake of our horse's diet. This is how they're designed to achieve their energy requirements. The next is their ingesta or food material moves onto the large colon. And the large colon on the horse is full of U-bends, changes in direction, 180-degree turns, and changes in diameter. So from a design point of view, this probably isn't the best way that horses, from an intestinal tract point of view, this is full of problems. Okay, if we're thinking about changing direction, going through 180-degree turns, and especially at the pelvic flexure, it goes through a 180-degree turn and changes to a smaller diameter. And this is only anchored to the body wall in one place. So this has the capacity to move out of its normal position. And we'll come on to that a bit later when we're thinking about the types of colic and how we classify them. Then in the small colon, our fecal balls are formed, then passes through the rectum, and then it passes out the other end as our fecal balls. Okay, so we're all familiar with this image, but I just thought it was nice to sort of talk through what should happen within the normal horse's digestive tract. There's some lovely videos available online if you're thinking about some more information about, quantities or lengths of guts. Probably as a vet, I find that sort of a lot more interesting. But it can be useful to think about how much is actually going on within our horse's insides. If we look at feral or sort of wild horses, it's quite surprising to see how much of their time is spent feeding and grazing. Okay. And studies have looked at these, and actually a lot of their eating actually occurs within a set period of time between sort of 8 a.m. and 4 a.m. They will follow seasonal patterns of foraging, okay? And but also what's quite important in these sort of wild animals, these wild horses, they also spend a lot of time moving. And that's a really important factor when we're thinking about colic in the domesticated population. These horses are covering massive distances every day, probably much more than our own horses and ponies are. And that can have a big influence on intestinal motility also. So the basis of this is that the horse's gut has evolved in a certain way. Okay, so they're designed to eat a mainly forage-based diet. They're designed to be grazing for long periods of day. And that they're not really designed to have large meals. They have a limited starch and sugar intake. And they've got a choice of things that they can eat in the wild too. They're constantly moving. Okay, so they're not confined to a specific area. And they don't have massive changes in their dietary provision. Okay, so there's a very low risk of their diet changing rapidly. But what happens in the sort of domesticated population? What happens today? Well, actually, a lot of the time, horses are now fed high concentrate meals. That we give them forage that's dry. They can maybe have intermittent feeding times. There might be limited activity if we think about how active horses can be. They don't have much choice in what they can eat or when they can eat it. And sometimes out of our control, but we make sudden management changes or we make sudden changes in their activity levels. And all of this can have an impact on the horse's digestion and intestinal tract. So that's an overview of kind of how the horse works on the inside. And now I want to focus a little bit more on the types of colic that we'll see. So colic as a word, all it means is it's the horse is exhibiting pain from somewhere in the abdomen. Okay, this could be our gastrointestinal organs that we've just talked about. So from our stomach, the small intestine, cecum, large colon or small colon. But it could also be a manifestation, a sign of pain from some other organ within the abdomen. So maybe the liver, spleen, pancreas, kidneys, bladder, or in the mare, the uterus or ovaries. So we've got to kind of have this in our mind when we're thinking about a horse that's presenting with colic signs. And part of our workup as vets will be assessing what's going on internally. So if we're thinking about what intestines can do, okay, we know that they're only fixed in, we know we've got meters and meters of small intestine. We know we've got large changes in our diameter of our colon. It goes around U-bends, it changes direction. So there's lots of things that intestines can do. So some of the things you might have heard, if any of you have dealt with horses with colic, is that intestines can become blocked. We might refer to that as vets as an impaction or an obstruction. Intestines can form excessive gas. So we often will refer to that as gas or tympanic colic. They might move too much. They might what we call be hypermotile. And that's referred to as spasmodic colic. They might stop moving altogether. And that is a condition called ileus. Occasionally, they might even telescope into themselves. And this is called an intussusception. Very rarely, they might actually go through a hole within the body. So we might get herniated intestine. They might move from their normal position. So in the normal anatomy, the small intestine and colon has its own little home within the abdomen. But occasionally we can get parts of the intestine moving from its normal position, and we'll refer to that as a displacement. Intestines can become infected or inflamed, and then we'll refer to it as an enteritis. Parts of the intestinal tract can develop ulcers. They can occasionally become twisted, and we might refer to this as torsion. And probably most severely, the intestines can be so severely affected that they lose their blood supply. And we refer to this as a strangulation. I've highlighted as strangulation because this is probably one of the most severe forms of colic. But as you can see from this, colic isn't sort of one single thing that the intestines can do. And there may be lots of things, or might be different variables going on. If we look at the breakdown of the type of colics that we will be faced with, this is a survey taken from a large number of horses within the UK that were showing signs of abdominal pain. The majority are, and we've color-coded these, we've kind of got a traffic light system, with green being the lower end of severity to red being the most severe cases. So we've broken these down into the types of colic that are typically presented. So our spasmodic and gas colics are probably the lower end of the severity scale, to the maximum where we've got our surgical, our strangulating lesions. And our strangulating lesions is where our intestines have lost its blood supply. So this is an image. This is an image taken during colic surgery. So the horse is within the operating theatre, and it's the underside of its tummy has been opened up surgically. Okay, so we're performing colic surgery. We've actually exteriorized the portion of this horse's colon. And as you can see, it's a pretty angry looking dark red color. This is not a healthy looking intestine. This intestine has become strangulated. It's lost its blood supply, and therefore this gut starts to die. Okay, and this is a really serious situation for a horse to be in. This can affect both the large and small intestine of the horse. And in these cases, surgery or euthanasia are our only two options. Okay, these horses are not going to respond medically. So we need to think very carefully about whether surgery is an option, and if not, unfortunately, euthanasia is the only other option. We do, the data, we've looked at large numbers of colic operating cases, and we do unfortunately have, even still now, lower post-operative survival with horses that have strangulating lesions compared to non-strangulating lesions. So once that gut has lost its blood supply, the survival rates, unfortunately, in the horse are lower. So I've given you probably all the doom and gloom about colic, but what is there actually that we can do about it? How can we prevent it? What are some of the risk factors that we need to be aware of as owners? So there's a really nice, excuse me, there's a really nice, it's called a colic risk rater tool, and it's available online. And I think this is a really neat tool that owners can use. Okay, so you can completely adapt it to your personal situation, and it will give you a risk of colic. Okay, a colic risk for your individual horse based on a series of questions. And I think this is a really nice way of evidencing or highlighting some of the factors that we can do as horse owners to improve our prevention of colic. Okay, so it's something that you probably don't need to try out now, but it's something that you might want to look at for your horse in the future. So unfortunately, there are some things that we can't change. I'll start off with these, and then I'll move on to some of the more positive things that we can do something about. So different ages of horses, we have no control of how our horses age, unfortunately. But different ages are at increased risk of different types of colic. What gender are horses? Mares, especially post-foaling mares, these are at 13 times more risk of a large colon torsion compared to the general population. Stallions, are a greater risk of an inguinal hernia. So this is where gut will herniate through the body wall in the inguinal region. And certain breeds we know from the data are at an increased risk of colic also. Horses that have got a greater height have got an increased risk. And also those that show stereotypical behaviours. So things like crib biting and wind sucking have an increased risk for certain types of colic, especially things like epicloic foramen intractants. And unfortunately, if we've had horses that have had colic in the past, we do know that they are an increased risk of colic in the future, sadly. So some of the management factors that I'd like to move on to now. So if horses spend a reduced amount of time at pasture or no time at pasture, that is a risk factor for colic. So the more hours that a horse is stabled has an impact on its colic risk. Any recent changes in diet have an impact. And I think recent I think it's important to explain this a little bit further. I think from recent we think about, you know, something that I've done today or maybe yesterday, but actually anything that's happened to that horse in the last 2 weeks can be significant from a colic point of view, due to the fact that it takes that amount of time for the bacteria, the microflora within its intestinal tract to respond to dietary changes. Large amounts of concentrate intake are a risk factor. Inadequate water intake. Okay, so if horses aren't drinking what they should do, or if they have changes in their water intake, that is a risk factor. Dental problems. If at the start of that food journey, they're not able to chew their food appropriately, and this is obviously a problem more commonly in the older or the geriatric population, but we often need to make adjustments to their dietary intake in relation to this. Poor parasite control is a risk factor. Changes in the exercise level. Their exercise level is inherently linked to their gut motility. So actually activity is very good for horses' gut motility, so how well it moves. If we make rapid changes to their exercise level, that can have an impact on how well their gut is moving also. And also drug administration. So things like bute and other non-steroidals can have an effect in different parts of the horse's intestinal tract. Recent transport is also an increased risk for colic. Something we don't often think about is how many people are looking after our horse. Data is showing that actually if a horse has multiple carers, then it is actually an increased risk compared to a single horse owner that looks after that horse solely. So if we're thinking about how we can minimize some of these risk factors and ideally prevent colic happening. So if we think of these also as kind of layering on top of each other, okay? So if we're thinking of a horse that maybe has had, you know, a change in exercise, isn't grazing as frequently, and maybe has poor dentition, is therefore spending maybe some more hours in the stable, we might have instigated some dietary changes. It might not be drinking as much as it would be if it was out grazing. All of these things can add up, and we've got to try our best to minimize a lot of these risk factors if we want to try and minimize the risk of our horse developing colic. So as you've seen from the previous slides, a lot of these risk factors do relate to actually how we manage our horses. Not entirely, but a lot of them will do. So evolutionary wise, horses are very well equipped for an entirely forage-based diet. So therefore, if we're going to mirror how they're designed and how their intestinal tracts have been evolved, we need to provide plenty of roughage. Ideally, horses should be having continuous grazing. So as owners, we need to try and maximize turnout as much as possible. And I know this is challenging for those, those horses that will gain weight excessively when they are grazing. But we need to think about, their grazing patterns and how much they're moving. Horses are not evolved for large meals. So large single meals or large meals either end of the day. And they're not really equipped for large amounts of starch and sugar intakes. So if we do need to provide hard feed to meet their calorific requirements, we really need to be thinking about quantities and feeding no more than is necessary. Trying to split that down into more palatable or multiple feeds during the course of the day, rather than these sort of morning and evening peaks. A maximum of 0.5% body weight per feed. So if we're thinking about maybe a 500 kilogram horse, that's 2.5 kilograms of hard feed. And some of the sort of conditioning cube scoops, they're nearly 2 kilos a scoop. So it just kind of puts it in perspective. And ideally a low in starch sugar content. Horses like to be constantly moving. And this does definitely help their intestinal motility. We see reduction in intestinal motility when horses are stabled or if they're put on box rest for a condition. So daily exercise and turnout when safe to do so is really, really important. And if we think about making dietary changes, a lot of these have to be very, very gradual. So if we do need to make changes, we should be doing these very slowly, normally over about a 2-week period, if we're thinking about how long it takes those bacteria in the gut to adjust. So gradual dietary changes to our horses and ponies. In addition, making sure, it probably sounds obvious, but an adequate water intake. Making sure that simple things that they've got, access to clean and fresh water. Okay, that we're replacing buckets, that they're clean and they're water that horses want to drink. This can be challenging, when we're going into the winter months when the water's getting cold or potentially even freezing. And also if horses are within, a group of horses, they're more than one water source, because the sort of behavioural hierarchy can come to play. So making sure that horses have got access to water when they want it. Parasites are a risk factor that we've discussed earlier for colic. So consulting your vet about a suitable parasite control programme. Testing scheme is paramount. Dental problems we've touched on previously, so providing regular dental care, making sure that there's not areas where of oral pain, or that we can ensure that our horses can adequately chew and grind their food as they should be able to do with their cheek teeth. Transport. Transport is a risk factor, so making sure that they've got hay or haylage, some sort of forage during the journey, and water during transport, and then monitoring them closely after they've travelled. Multiple carers. Obviously, this isn't, in many scenarios, this is, unfeasible to have just one single carer. But minimizing the number of carers. And if we do have multiple carers, ensure that each knows that individual horse's habits and routine. Keeping horses to routine is a really important factor in terms of their feeding regime, and making sure that we're not getting big fluctuations in their feed and diet, by miscommunication between carers. Changes in exercise level. I've put here, don't change it, unless necessary. There will be instances where unfortunately we have to, strictly impose box rest because of an orthopedic injury. But if we've got the choice, then we shouldn't be making exercise or turnout regimes suddenly. Okay, this should be a gradual process to allow that horse to adapt. Crib writing and wind sucking, some of the stereotypes we mentioned. Trying to minimize stress in these cases is really important. Maximizing turnout where possible in these can be a useful tool as well. Drugs are sometimes inevitable. We'll have to give them, but I really want to stress, don't give any drugs without veterinary supervision, without a vet that knows your horse and can advise you appropriately. Some of the some colics will still, despite all our best intentions, they will sometimes still occur, and this sort of comes back to knowing your horse, okay? Knowing what your horse does naturally, knowing how it behaves, and being able to react to that in a timely and appropriate manner. So it's little things like knowing your horse's normal fecal output. Does it normally have 9 poos overnight? And then when the next day it only has 3 poos overnight, you're ahead of the game. Okay, so picking up these small changes in your horse's behavior. Does it normally eat all its feed? Okay, how much of its hay net is left in the morning? Okay, all of these things as owners we should be aware of and be able to adapt to. How much of its water is it drunk? Okay, if it normally drinks half a bucket overnight and it's not drunk even a centimetre overnight, these are sort of things that can be important in preventing things escalating. So some of the take-home messages I wanted from this evening, it's not a single disease, okay? It can be multifactorial, can be different things going on, and it has multiple risk factors. But many of these risk factors can be modified by a change in management. Okay, just so thinking about how we manage our horses day to day can be really, really important. And ideally, prevention is the goal. Any questions?
Thank you very, very much for that, Kate. That's so interesting. And what I really love about a lot of our webinars is that it comes back down to a lot of the time the 3 Fs about actually how that sort of more holistic view and that the preventative messages came through loud and clear. So no, thank you very much. And we've got a host of questions building up now. I just, for those that can cast their mind back to before you started speaking, I asked a poll question, and I would like to see if Basil can ping those poll results up for us to see what the poll results were. So the question was, have you ever owned or managed a horse that has experienced colic? So 60% of our audience tonight on Zoom, shall I say, have, and 40% haven't. So yeah, just over obviously a slightly more unfortunate split going towards that. So hopefully there'll be more questions coming through. For anybody obviously on Zoom, there's the Q&A tab, so please put any questions in there. You can also upvote any question that you really want us to ask. We'll hopefully get through as many as we can. And for anybody on YouTube, again, please put your questions into the chat box and we will whisk them over to Zoom so we can read them as well. There's also a nice spread of audience members tonight. So we've got people from all over the UK coming in, as well as some European viewing as well. So I saw Sweden ping in there as well. So yeah, a nice mix from the audience as well. So thank you. Joining Kate for our Q&A session is one of our field officers, Leanne McPake. So let me just share my screen and I'll bring up Leanne's details. So Leanne is one of our field officers, as I said. She has worked in animal welfare for over 15 years, previously working on large-scale studs in New Zealand and Australia. She's been one of our field officers, covering probably like half of Scotland, I think. So a large area in Scotland. She has graduated with a BSc in agricultural science in 2006 and recently attained her master's in animal nutrition, hence why she is joining us tonight. And very importantly, she has loved and owned horses for over 30 years. As I say, we usually share a bit of a quirky fact, and Leanne might be scared now because what I'm about to share. But my little interesting fact about Leanne is that she recently returned from a far-flung trip to Southeast Asia. She might be feeling a bit tired tonight, so we'll just need to kind of keep her awake and keep her going through this. So welcome, Leanne, and thank you very much. Perfect. So I'm just going to start off with a couple of questions, structured questions, just to get our Q&A session going, while we hopefully have more coming in from our audience. So yeah, Kate, I'll start with you. So again, thank you very much for your presentation. That was, as I say, really informative. But why do some horses seem more predisposed to having a higher risk of colic?
There are the inherent, I think, uncontrollable risk factors. So horses, of different ages, the bigger horses, certain breeds. So I touched upon, Arabs and thoroughbreds, and some of our miniatures are predisposed. But inherently, each horse is an individual as well. So we have individual variations, and others, and some just do appear a lot more sensitive than others. My old lecturer used to equate it to the similarities in humans. Some people can cope with a really spicy curry, and others will really, really not. So we know that horses that have had colic in the past, especially colic surgery in the past, have got an increased risk. So I think it can be quite frustrating. Despite our best interest, we'll sometimes have those horses that will be more predisposed than others, unfortunately.
Thank you. And then just you obviously you've touched upon breeds as well, and from your selection of breeds, we had some sort of larger breeds, and actually some minis were included in there. So it's not necessarily just sort of larger horses, is it, that are more predisposed, really, think?
No.
Thanks. And so, Leanne, as I say, welcome. Many owners we know that like to feed straw to help weight loss, and obviously winter is quite a good time to try and use winter to our advantage a little bit. Is there an increased risk that this might put them at higher risk of colic, or is that a myth, in your opinion?
So I think it's important to say, firstly, is that horses with bad teeth, poor dentition, shouldn't be fed a straw diet, because obviously they're going to really struggle to break down the fibrous and lignans within the straw. But in terms of a horse with good teeth and using it as a weight management, it can be really good to feed it 50%, 50% of their daily forage intake. And the research within recent years has not showed any increased incidence feeding at 50% of their daily intake of forage that it will cause any more incidences of colic. What it is really important to say is, so straw does have a high dry matter content. So, and as Kate said quite a few times within our talk, that feeding, making sure that there's water, fresh water available for them is really important. It sounds a silly thing to remind people, but it is really important, especially feeding straw. The other thing about that's probably quite good about straw is that because it takes them it makes them chew more, so it takes them longer to eat, so it slows down their intake, and it keeps a steadier sort of stream of forage. So especially for maybe stabled horses over winter months, it can be quite handy to ensure that they've got forage for longer.
So perfect. So sort of, yeah, I'm just going to say, so so it's a sort of a good tool for us to, particularly owners when they've got maybe slightly good doers, but just keeping an eye on that water take at all times.
Yes. Yeah.
Perfect. Thank you for that, Leanne. And then back to you, Kate. Like, how can horse owners assess their own horse's risk of colic?
I think being aware of the risk factors is probably one of the most useful things, alongside knowing their horse really well. So I touched on it in the talk, knowing what's normal for their horse, knowing their fecal output, knowing their water intake, knowing their normal behavioural changes. Is it lying down in the field? Is that normal for this horse? Does it enjoy like a mid-afternoon nap in the field? Or the fact that I've come down at 3 o'clock and it's lying down in the field, is that something I should be concerned about? So, and I would urge owners to always act on their sort of gut feeling with this, excuse the pun, in the colic talk. But you are the best guardians of your own horse. You know them best, and actually, picking up the phone, having a chat with the vet. Maybe you could take a pulse rate, assess, or be able to monitor this horse for a period of time to be able to detect any early conditions. Because actually, if we can detect these conditions earlier, then often our success rate and our treatments are a lot more effective. So it's getting, I suppose I would say knowing your horse and acting on if anything isn't right. Being ahead of the game a little bit in terms of changes, making changes very slowly, being ahead of sort of climatic conditions. Are we expecting, frosty weather? Is it likely that the water troughs are going to be frozen? Do I need to, horses don't like to drink cold water very much. Do I need to put some warm water in with it? Do I need to soak the hay? Do I need to do active things as an owner to increase that horse's water intake? All of these can be really important things, but knowing what's normal from your horse is probably the most useful.
I think kind of definitely as owners, it's almost one of our biggest concerns that we might just miss those early signs, isn't it? But almost exactly as you're saying, sort of trust your gut, and vets are always just at the end of the phone as well. And I imagine more than happy just to advise and come out if need be, or monitor and help you monitor otherwise.
Yeah, absolutely. We're always willing to, have a chat. Doesn't necessarily mean we need to jump in the car straight away, but sometimes we can allay some of your concerns. Sometimes we can give you practical strategies, knowing you and your horse. And that's probably the best source of advice that you can get.
Perfect. Thank you. Leanne, so obviously with your sort of nutrition side of knowledge, but we know like many feed companies now are offering some quick soak mashes. What impact of feeding these do you think they could have on incidences of colic?
I personally wouldn't be overly concerned about feeding a mash. They've got some really good benefits. It can ensure water content, in their feeding, and that the horses are getting the optimal hydration level. So it's good for adding extra water into their feeds. Can act as a lubrication. A lot of the feeds that are on the market, the mashes that are on the market, are sort of really high in fibre and low in starch. And I think we always need to be mindful of making sure we soak them to the correct manufacturer guidelines, and obviously feeding in taking the guidelines that are given in terms of feeding ratios as well as soaking.
And I think that's, and it's really key. And I know that, definitely some of them are like 60-second soak, and other might require 10 minutes. Others might be a bit quicker in warm water. So just make sure you know what the instructions are on your packet.
Very much so.
Thank you. And then this is a really question to both of you. So if you had to pick one management change that would have like the biggest impact on helping to reduce the risk of or prevent colic, what would it be? And I'll go to you first, Kate.
I would say gradual change. Don't make sudden changes. Horses really are sort of creatures of routine. Their guts are even more so. Okay, they do not like being challenged from a one day having this and then the next day. Sometimes it's inevitable. Sometimes we fall short. Sometimes you will run out. Things happen, but if we can at all avoid it, that would be my number one tip: is make gradual changes. And that gradual change has really got to be over a decent period of time, so over that sort of 2-week period. And this can have impacts in lots of things. If we're planning to go away for a competition, okay, and we know that horse is going to be in a stable for a lot longer, start making those adjustments to that horse's routine. Okay, so we're not taking it from 12, 14 hours out in the pasture to a competition where it's going to be stabled all weekend in a box. If we're thinking about this time of year, horses are coming in for longer periods of time for the majority of us. Start thinking about those changes that are going to be made ahead of time. So you're just giving the horse the best chance to adjust and make those necessary requirements that its gut needs.
No, and that's and that's really good. It's and a lot of it almost like hearing you say it makes so much sense as well. And I know kind of definitely sometimes when you decide maybe my horse is going to come in this weekend, and then that's it, you bring them in, rather than actually if we could even just gradually build up to longer periods in the stable, and vice versa at the other side of the year. Just chucking them out maybe isn't the best approach, rather than building up to living out.
I often think we're a lot better doing it the other way, how much we increase their turnout, but we're not always quite as good as how much we keep them locked up, because actually we think, we're replacing their grazing with forage, but it's actually those other things that we're not doing. They're not moving around as much when they're in a box compared to out in the field, and that's the sort of adjustments we need to be considering as well.
And Leanne, what's your views on that question?
Can I say a few?
Oh, of course, yeah.
I think, going on what Kate said as well, adequate turnout is really important. Keeping that steady stream of forage, so high fibre diet, low starch, and again, fresh water at all times.
Thank you. So we're going to now go on to the audience Q&A. So again, just hopefully a final reminder that if anyone's got a question, now is your time. So put it in, for those on Zoom, put it in the Q&A, or those on YouTube, put it in the chat, and we will whisk it across here. And anyone else sort of watching on Zoom, you can upvote the questions. So I am going to start with a question that came from YouTube. So Kate, I'll go to you first. What are some of the early signs of colic we should be looking for?
This can be quite variable between horses. And it depends a little bit on the type of colic that they present with. So for things like impaction colic, it might just be reduced fecal output, or it might be that their feces are drier than normal. Okay, so looking at fecal quantity, but also quality. So their sort of texture and their appearance is useful. Sometimes it's just the horse not being quite right. Okay, so it could be those subtle signs of spending increased time lying down. It could be starting to show actual overt signs of abdominal pain, so tummy pain, where they're actually flank watching, they're turning around and looking at their flank as if to say, oh, there's something sore in there. And often it's just these very subtle signs. They might have an increased heart rate, but we will often won't detect that as an owner because they might just be subtle elevations. They might have a reduced feeding intake. You might offer them their tea and they just think, oh, actually, normally this is a horse that will be voraciously eats its tea, but actually it just looks at it and says, oh, actually, no, I don't really fancy it. So a lot of the signs can be very subtle, but I would, it goes back to sort of knowing your horse, knowing what's normal for it. And if you're not sure, then do react and respond to what that horse is trying to tell you, because sometimes it is quite subtle.
Thanks, Kate. And really, just as a follow-on, so Leanne, I'm going to come to you for my next question, but Kate, there's another question that's come through that ties nicely, and it says, do all horses show then the same symptoms of colic?
No, the horses can be very variable. And actually we get horses that are very stoic. So they're actually very poor at showing signs of pain. So horses are fundamentally like a prey animal. It's not in their best interest to show signs of weakness. And we definitely get sort of breed variations. We also get certain, donkeys are the worst at this really. By the time a donkey is overtly colicking, there's often something very, very serious going on. So it might be just that this donkey is more subdued. It might be inappetent. It might be slightly lethargic. But horses are very sensitive. They're a bit like human. Their pain thresholds are slightly different. So the answer is definitely not. They don't all show the signs of pain, and sometimes the amount of pain isn't directly correlated to how serious the condition is. So I would urge you, if your horse is exhibiting any signs of colic, to get it checked out.
Loud and clear. We're definitely getting that checked out. Leanne, there's a question here from Andrew that says, hi, I work in horse racing. There seems to be confused beliefs regarding feeding hay before exercise. Some say never feed until after they have been exercised. Some say do not feed hay for an hour afterwards. Others say there is no problem. What's your views on feeding hay then before exercise, do you think, Leanne? You are on mute, so you just need to unmute yourself as well.
Thanks. I personally, small amounts. I think actually it has benefits, and Kate will be able to go into the benefits of fibre to prevent ulcers and things beforehand. So, from my point of view, I don't have an issue in feeding small amounts of hay before exercise. In terms of afterwards, I think Kate would maybe be better at answering that than myself. But yes, beforehand, certainly, I don't have an issue with it.
Perfect. Kate, do you have anything to add on top of that?
I'd really like to normalise this, that horses got free access to forage up until the time it's raced. I don't know if anyone saw recently, but it was the Melbourne Cup and Prognosis that came second in the Cox Plate, or the Melbourne Cup, was pictured with a nice big hay net before it raced. And I think that should be, and we know there's long-standing data that this is a really positive thing for horses to have a nice decent fiber mat in their stomach before they race or they have any intense exercise. So for me, I'd like to see more of it. I think it should be not a rarity to see those sort of scenes.
So we really should be championing forage before exercise and
Horses
after
love
exercise.
forage. That's how they're designed to eat. That's how their whole intestinal tract has evolved to become. Absolutely.
Right. I bet the horses are going to be happy to hear you say that too. So we have one here, and Leanne, I'm going to come to you for this one. So how careful do we need to be when changing fields, for example, from a well-grazed field to maybe a slightly more fresh, lush grass?
Well, I think Kate was really clear in our talk that we need to, change. We need to do it slowly over a period of time, and I think we need to be aware of that in terms of changing fields from well-grazed fields to lush fields. So similarly, if we can do that on a sort of a slower introduction, then I dare say there's lots of people on tonight that are guilty of, there's a nice green field and we just chuck them out in it. But I think Kate's been really clear throughout that we should make change gradual, and I would think that's the same within the fields.
Yes. Yeah, no, thank you. Yeah, and I think, as you say, it's just that sort of that gradual change. And Kate, is there anything else that again you'd like to add on, or is it really just that gradual?
No, I completely agree with Leanne. We have to make those changes, but if we can make those gradually, that would be in the best interest of the horse.
So one here for you, Kate, as well. So our horses are kept from YouTube. Our horses are kept on really sandy soil and are difficult to keep the weight off. Can we do anything to help manage them?
Yeah, so sand, that's a really, really good point. So horses that graze really sandy areas are prone to a certain type of colic. There are management strategies that we can instigate from a kind of nutritional point of view. There are supplements that we can administer, which will actually bind the colic. So sand, actually, you can imagine if you're eating lots of sand, which is inevitable if horses are grazing to the real sort of low levels of the sand land or sandy paddocks. Actually, if you think about that on the inside of your guts, it's really abrasive and it can be quite inflammatory to the gut. It can also accumulate in parts of the intestinal tract. We know that it goes around these U-bends, it changes direction, so we can get accumulations of sand. So we can sometimes as vets recommend things like psyllium as a sand binder. I think probably in these cases it's best to speak directly to your vet, knows your husbandry and your horse and your sort of environmental location to advise exactly how much is appropriate and how often. But there are management strategies for certain areas that we can definitely instigate.
Yeah. And is sort of sandy soils probably one of the more higher risk soils? Do people on clay have any sort of anything else that they might need to be aware of, or are we really talking about sandy soils?
Mainly sand is the issue. Horses don't really like clay. There might be sand, land disturbance can be an issue with certain types of colic. If we're thinking about conditions like grass sickness, that can present as with colic-like signs or with overt colic signs. But yeah, sand is the main culprit, I would say.
Thank you. Leanne, and this it might be from your nutrition, it might be actually from a field officer role, but do you think, can an owner tell how serious a colic might be from signs that their horse is showing?
I think if you think your horse is colicking, you should always refer straight to the vet.
So if that thought was going through your mind, it's picking up the phone and making that call.
That's the professionals at the end of the day.
Thank you. And we're back to you, Kate. We're getting on through these questions well. So does an increased internal parasite burden increase the risk of colic? And I'm just going to add a why onto that as well.
So yes, it can, in a simple answer. And it can depend a little bit on because basically if you've got a big worm burden, it can cause intestinal inflammation. It can cause those intestines to be inflamed and aggravated. Certain types of parasite burden are associated with certain types of colic as well. So I mentioned in the sort of description of colic, something called an intussusception, and we have certain parasites that have an increased risk with that type of colic. So it sort of comes back to making sure that we've got appropriate parasite control strategies. We don't need horses to have a zero worm burden. That's, some horses might do, but it's not necessary for them to be absolutely zero eggs per gram. And there's some evolving, advice coming, and I know it can be quite confusing for owners to instigate a lot of the changes that we're trying to make around wormer use, but actually we're really responsible sort of testing and making sure that you're aware of what that worm burden is in your horse is really important, because it will increase if they've got a high burden. It will increase their risk of colic.
Thank you very much, Kate. And there's another one from YouTube for you, Leanne, here that says, how can I balance forage intake with maintaining gut fill whilst my horse is on a weight loss program to minimize the risk of colic?
Well, I think straw is a really good weight management tool, and as I said earlier in my comments, it slows down eating, it slows down their intake, they're chewing more. I think it's always, if you are feeding 50%, as we spoke about earlier, then you do need to make sure that there's a balancer, because obviously straw has less vitamins and minerals than what your hay or haylage would. So it's always worth either feeding a balancer or something like seaweed as well. That would be quite handy, because it covers an array of all the vitamins and minerals that they need. And I think that would the slowed eating helps with the gut fill. So yeah, sorry.
No, that's absolutely perfect as well. And I think, again, I'm just hearing, we're just obviously wanting to try and keep these horses eating for like as long as period as possible, while obviously reducing some of that calories that they're getting as well. So it is that balance, as you say.
And I think straw slows them down. It slows the eating process down that much that it does allow for a steadier process. And then obviously it's a lot more fibrous than lignin, so it takes a lot for them to digest it, a lot more than hay or haylage.
Thank you.
And also like maybe soaking hay, just so we're leaching out some of those rapidly fermentable carbohydrates as much as possible. But I would completely agree with Leanne. We want them chewing that fiber. That saliva is great. It contains loads of bicarb, which helps neutralize the stomach acid, which is really, really important for really good stomach health.
Thank you.
And really right in terms of the soaking hay, there's some really good research as well about the optimum times to soak your hay and at what temperatures, and I think that can be really helpful, because I think it's something like 8 degrees for an hour opposed to the 8 to 12 hours in cold water. So that can be really useful as well if you look at the research in terms of the times and the temperatures of soaking your hay.
That's really interesting, actually. Maybe that's one for another webinar about all, I'm just thinking, I'm definitely was guilty of the sort of the 12-hour dunk it in the morning and take it in the evening. So actually finding it good to do it much quicker would be useful. Kate, we've got a really good question here from Katie about so is there anything we should be doing if our horse is showing signs of colic while we're waiting for the vet to arrive?
So some simple things that you can do is making sure that it's somewhere safe. Okay, so somewhere safe and secure. Sometimes these can accelerate rapidly, so we want to make sure that if it does showing more signs of pain, that it can go down, it can roll if it needs to, and it's not going to get any secondary injuries. Removing any more food from it. This is a time where I'd say don't give it any more feed until it's been assessed. They can still have water, but don't give it any extra feed at that point. So they would be probably my top tips. And if I'm talking to a client on the phone, that would be the sort of advice that I'd be giving. Ideally, don't administer any drugs until a vet has assessed it. I know it's quite tempting to do, and sometimes that might be advised in certain situations. Or if you have given drugs, then do tell the vet when they get there, because if, that can impair, how we can assess and potentially react to sort of early conditions.
I think and I know sort of potentially like more historical advice argument, just keeping your horse walking, isn't it? And that's sometimes like as sort of an older thing in our heads, we kind of got that, just keep them walking and moving, but that's now changed, hasn't it?
It has changed. I mean, in some cases a little bit of light movement can be helpful. What is really detrimental to the horse, so if you've got a really painful colic, to actually try and keep it moving. Those horses that just really wanted to go down and roll, and they're literally being sort of walked around, because all you end up then with is a really tired and painful horse. Often clients are very worried about letting horses roll, because they think that guts will twist or tause as a result of rolling, and that's not the case, because otherwise, if every time a horse went out into the field or rolled in the stable, it would twist its gut. We know they're not well designed, but they don't twist as a result of rolling. Normally they're rolling because something has normally moved out of position or is already twisted. So for me, I'm not against letting horse, if a horse wants to roll, if that what makes it more comfortable, then as long as it's in a safe environment to do so. So things like taking, buckets or mangers out. So if it does go down and roll, it's not going to traumatize, or it's not going to hit its head or get its leg caught. Making sure that it's in a space that, if it goes down and rolls, that it's safe to do so. Sometimes that might be actually just leaving it in a small area of the paddock. If you've got a big horse and a not particularly big stable, that can be a bit of a challenge if that horse goes down within that environment. So assessing the situation, ideally getting that horse somewhere safe, not giving them any extra food or feed until it's been assessed, and ideally not giving it any medication, or if you do, then inform the vet when they arrive how much and when.
Just kind of, as you say, just keeping track of all those signs, and making sure we can keep the vet up to date exactly what's happened.
Yeah, and sort of common things your vet is going to ask you if you ring with a horse that's got suspected colic is a lot of them sort of management size. Okay, what's it doing now? What's this horse doing now? When did you last see this horse normal? Okay, was it 2 hours ago, or was it 16 hours ago? Okay, because a lot can have happened in those sort of time frames. Have you changed anything recently? Is it on any medication? Are you up to date with its parasite control? Have you administered any pain relief to it already? Has it colicked before? All those sort of questions, and in the moment, that can be quite stressful, because we feel like maybe we're bombarding you with questions when your horse is colicking in the stable, but they are fairly typical questions that we would be asking. Another thing I would say, if your horse is colicking, is if it's on a yard scenario, make sure that you have someone on that yard that can take responsibility in your absence. Okay, because that can be a really challenging situation. If the owner isn't contactable and the yard owner's found a horse that's colicking, knowing what plans you've got in place, whether referral is an option, all of these are really, really important things to have in place ahead of the time, because it is stressful when horses are colicking. And if the yard owner or a friend is dealing with this, just make sure you're explicit with what you'd like to happen in that situation. And if you can have those sort of clear and rational conversations before you're sort of in the heat of the moment stress, it can make everything a lot smoother, and it can also minimize delays in terms of getting that horse to maybe a hospital facility if that's required.
And from an owner's point of view, with having conversations with their own vet about options and outcomes and stuff, probably be the best option for them, just to kind of discuss all that in a non-emergency time.
Yeah, I mean those are all great conversations to be having at those kind of routine visits. Okay, so the vaccines or your dentals or you say that you sort of your health checks, but having that recorded on the vet system is really, really useful. So whichever vet then from the practice goes, they can pull it up and say, actually, no, this is what we've got in place. But also having those conversations with you know, your yard owner if you're in a yard situation, or you know, people that have got responsibility for that horse are really can make a really big difference. The worst thing we can do is, you know, maybe delay referral of a horse because we can't contact an owner. They might be out of the country, they might be at a work meeting, they might be for a number of different reasons, but that can make a big difference in terms of prognosis.
Okay, no, that's really, really good advice. Thank you very much, Kate. Leanne, I've got another question of straw for you. What's the best type of straw to feed?
So the best type would be oat or barley straw, and it's really important because they're the most palatable, and making sure that you've got a clean harvested straw, so not too much dirt in it, or but you know it's not been baled when it's been wet or whatever, like that's quite important. Wheat straw isn't as ideal because it's a lot more fibrous and lignin for them, and it's less palatable. So I would always say oat and barley straw.
Thank you. And then Kate, we've got a couple. I'm just going to combine a couple of questions. So there's one about does turning your horse out on frosty grass increase the risk of colic? And we've got another one from YouTube on a similar thing about is there increased risk of colic during particular seasons such as winter? From a new soon-to-be horse owner. So yeah.
So if I go the seasonal one first, we do definitely see seasonal peaks in the number of colics that we see in practice. So normally spring, summer, and autumn, not necessarily winter. And often that is related to sort of seasonal changes that are things that are sort of out of our control potentially. In terms of what was the first part of the question?
About yeah, seasonal risks, and then the other part was about frosty grass. Is frosty grass going to increase the risk?
There's not any data as far as I'm aware about frosty grass per se. I think probably along with that, if you've got frosty grass, you've probably got frozen water troughs. Maybe their forage intake might decrease slightly, but frosty grass per se, I'm not aware of any data. No. But they're probably sort of concomitant, there's sort of associated risk factors. They might be spending, you know, less time out. Often we like to keep them in the nice warmth of their stable if it's frosty. Or, you know, we might not be able to, you know, snow is the big thing that we often see in practice, especially in the UK, because the country comes to a stop, doesn't it, when it snows for a couple of days. So we maybe won't be able to visit that, you know, and normally a few days after we've had a period of snow, we'll see an increase in things like spasmodic colics, or specifically impaction colics. Horses have been kept in, they've had a sudden change in their regime, they've not been turned out, maybe the yard's been icy, we've not been wanting to, you know, turn them out for that sort of point of view. So yeah, I hope that's answered the question.
Yeah, and again, you're really highlighting that point again, that it's sort of that sudden change in the management is going to be a big risk factor there. And I think yeah, Leanne has a question about sort of, we've obviously talked about water quite a lot, about the importance of water. I'm just thinking of the people, particularly at competitions and stuff like that, when you just can't get your horse to drink some water. Do you have any top tips in which we can be ensuring that our horses are getting enough water, particularly maybe when we're away from home, to reduce the risk of colic?
I think adding, if you're going to offer them a mash, a really watery mash or some sugar beet water, for instance, that can be really palatable and encourage them to drink. I think obviously offering fresh, clean water on a frequent basis, so not having it too warm or too cold at the same time, obviously is going to encourage them to drink a bit more, but just offering it as frequently as you possibly can. And if you're used to feeding them a mash, then that can be quite a useful tool in making just an extra watery mash, and the palatability will encourage them to eat that, and they'll obviously absorb water at the same time.
Great, thank you. And then we've got a question here from Melanie. And I'll put it for you, Kate. So why are horses that have experienced colic more at risk for having a future occurrence of colic?
I mean, that's the golden elixir. I'd love to know. We know that and I think it probably comes down to their inherent sensitivity a little bit. Certainly horses that have had colic surgery are at increased risk, especially if they've had gut removed, or they can have secondary consequences as a result of the surgery. So complications such as adhesions, where little bits of the bowel stick together as a result of inflammation. But yeah, I think if I knew the answer to that and prevent it, I'd love that. But I don't have the answer, I'm afraid.
No, thank you for that, Kate. As you say, yeah, would be saving a lot of owners, a lot of angst. Yeah. Leanne, how gradual is gradual when we're making changes to our horses, in your opinion?
I think the 2-week period seems to be the gold star, doesn't it, Kate? If you can do it over a 2-week period, I think that's sort of ideal. And obviously, not everybody. Sometimes life takes over and you don't have 2 weeks. But especially if you're looking to change feed, then I would certainly be looking at a 2-week period. Just little and often, obviously.
Thank you for that. And then we've got, I think, going back to you, Kate, one from John saying, do you think a substantial amount of mild colics are undiagnosed ulcers?
That's a really good question. I think we probably do have a lot of undiagnosed ulcers. So we're just talking about gastric ulcers here. We do know that a large proportion of the equine population do have gastric ulceration syndrome. I think it's quite variable in how these present, whether they are presenting as colic or sort of the more sort of subtle signs of poor performance. I think it goes back to those sort of basic principles of plenty of forage, maximizing grazing, maximizing turnout, keeping these horses chewing, keeping that saliva being produced, keeping all that bicarb floating into that stomach, because we know that horses secrete acid at a constant rate because their whole evolutionary process is designed to be grazing, for 21 out of 24 hours a day. And then when we stick them in a stable and their hay net runs out and they've got periods of, enforced starvation, then that is detrimental. So the answer, John, is I don't know how many are, without scoping every horse that presents, but there probably are. That's probably my honest answer. There probably are. And I think it often becomes more apparent in those kind of recurrent colics or those kind of low grade colics that might happen over a period of time. And we will often then gastroscope, so put a camera into that horse's stomach and see what's going on in there. It's then trying to associate the correlation between what we see on our gastroscope and actually what that horse is exhibiting can be the challenge. But yes, there probably are. That's in my opinion.
Thank you. And
that's a very roundabout answer, I'm afraid.
No, and it's really good to have actually all the detail behind it as well, because it does keep us thinking and on how to kind of best minimize these risks. And we're down to 2 questions, so we're gonna get through our Q&A session tonight, so which is great. But obviously, if anyone has any more questions, you can try and squeeze a few more in. But Kate, I'm going to come to you with this one about going back, thinking about sand colic again. So are horses more likely to suffer from sand colic in spring with the new grass, or autumn winter when the grass slows down growing?
Normally when there's less grass, so when the grazing, the pasture gets poorer, because out of choice they wouldn't choose to eat it, and when the sward length is long enough that they don't ingest it, then their risk is reduced. But actually, when they're, then they're getting around to the short little tips, whether that be spring as it's coming through or autumn winter as it's kind of disappeared, it could really be either.
There's more to do with like how much grass is currently covering it, the sand versus time of year. And Leanne, here is a really good question for you to finish on as well. So the question comes from YouTube and it says, I'm on a livery yard and the routine is changed by the manager. So how can liveries influence their horse's routine if they're worried about the risk of colic?
I think, especially when you're on a livery yard, it is really difficult. And there's so many needs and requirements of different owners and horses. And I think communication can be key here. I think speaking to your livery yard manager and explaining your needs and your concerns and your horse's needs and is really important. And I think that communication can help influence their decision. I suppose keeping your feeds the same. It depends. I suppose all livery yards are different, aren't they? And they have all different management styles on how much control you have in terms of your horse's feeding and things. So I think personally, I think communication is key here, and trying to keep things as constant and as much routine as possible. I don't know if Kate has anything else. Any other thought processes on that?
I think you're spot on. I think it's just that open communication, that dialogue. But most importantly, with that person that's making the decisions, the person that's in charge, the person that's enforcing those, and sometimes it's just that that chat or that explanation that this is the way I'd like to do it with my horse. Is there any way, how can we facilitate that? But it can be a challenge, and I see it in practice. But I've also seen it work very successfully where, I think, just comes down to communication, but communication with, the person that's making those decisions, not necessarily sort of around the houses, goes directly to the decision maker.
And by communicating, you understand each other's needs, don't you? And it does help influence change.
Yeah,
no, definitely. And I think as well, like the obviously plugging these webinars a bit at the beginning as well, but actually the more that, so you can actually, you two have been able to convey a lot of quite complicated information around the risks of colic to us, and like them in a really sort of nice and informative way. And I think the more that if there's a few of you on the same livery yard, if you're watching things like this webinar, you're then coming from this sort of singing from the same song sheet, if you do need to have sort of a more open discussion as well. So I think kind of sharing resources as well on potentially why risks at the livery might exist and how that could be improved as well. So no, thank you very much, both of you, for all of your support and help for tonight. So we are coming towards the end of our webinar. So I would like to ask you both just have a think about like maybe like a really key take-home message for everybody that's listening on what we have been talking about tonight about preventing colic. So Kate, can I come to you first to see what would your take-home message be for everybody?
Take-home messages: trust your gut, your horse best, and make changes gradually. I cheated there because I put multiple.
Sorry. No, that's good. Yeah, multiple take-home messages are fine. And Leanne, what from your side?
Well, my first note there was Kate's last message was gradual change, adequate turnout. Again, going back to steady supply of adequate forage and water, making sure that they've always got clean, drink fresh water.
Thank you very much. Yeah, and you have done an absolutely outstanding job tonight, and I think you can maybe even see some of the chat, all the thank you messages that are popping up from everybody. So that is very much aimed at you two for all that. So I want to just take this opportunity, as I say, to one more massive big thank you to you both, and particularly for Kate for stepping in so last minute, and for Leanne for staying awake for the webinar as well. Thank you. Our next webinar is going to be on Wednesday, the 27th of November, where we're going to be joined by equine science researchers and lecturers. That's going to be Dr. Seb McBride and Andrew Hemmings, and they're going to explore equine stereotypic behaviours and how best to manage them. And I also want to take this opportunity to remind everybody that we really do rely on the sort of the minds of all of you watching over how we might want to do some future webinars. So if you have any suggestions for a future webinar topic, please do email us at education@worldhorsewelfare.org. So yeah, thank you to everybody who is viewing as well for attending. And yeah, well, a big final thank you to Kate and Leanne for your time and expertise tonight. Thank you.